Hey everyone, it's Dr. Marcon with part 2 of chapter 25, Reproductive System, starting this part with the female reproductive system. So the female reproductive system also produces gametes in the form of ova. Prepares to support a developing embryo, undergoes changes according to the menstrual cycle. The menstrual cycle is the monthly cycle as it affects all female reproductive organs. And the female reproductive system includes ovaries, as well as uterine tubes or fallopian tubes, the uterus, and vagina. So just like the male reproductive system, we will start with the female external anatomy. So external female anatomy includes the vulva or pudendum. The vulva or pudendum lies external to the vagina and contains these structures. So it includes the mons pubis, which is that fatty pad anterior to the pubic symphysis, the labia majora, the labia minora, the clitoris, the bulbs of the vestibule, as well as the greater and lesser vestibular glands. So contained within the external genitalia and female perineum, the mons pubis overlies the pubic symphysis, so is anterior to it. Pubic hair covers the mons pubis after puberty. The next structure we're going to talk about is the labia majora. The labia majora is a homolog, meaning it is a structure similar to or synonymous with the male scrotum in the male reproductive system. So the labia majora will enclose the inner labia minora. Now the vestibule is the space between the labia minora, which houses the openings to the urethra and the vagina. The next structure is the clitoris. The clitoris is anterior to the vestibule. It is an erectile tissue, and the homolog to the clitoris is the male penis. So within the female perineum you have borders. Again, the female perineum contains the opening to the urethra as well as the vagina. So the anterior boundary is the pubic arch. The posterior boundary of the perineum is the coccyx, and the lateral boundaries are the ischial tuberosities. So pretty synonymous with the male perineum. And here we see the female perineum. Again, the anterior portion, anterior boundaries being the pubic arch, and then we have the ischial tuberosities forming the lateral boundaries, and then here at the coccyx is the posterior boundary. So this diamond-shaped area being the female perineum, contained within the perineum are the labia minora, the vaginal opening here, and the external urethral orifice, so the opening to the urethra, as well as the clitoris. And guys, take notes. In order to find the clitoris, you just follow the labia minora up, and then it'll be underneath this prepuce of the clitoris, so it kind of looks like a hoodie, and underneath that prepuce you will find the glands of the clitoris. So again, just the boundaries that we can see. So here we see the pubic arch, and then the pubic symphysis here. So the pubic symphysis here, you can see the body of the clitoris that also can contain corpora cavernosa, just like the male penis. And then we have the glands of the clitoris, and then we have specific glands such as the vestibule and greater and lesser vestibular glands. Here we see the vaginal orifice and the external urethral orifice. Okay, so notice that the urethral orifice is anterior to the vaginal orifice. Internal female anatomy includes vagina, the uterus, the uterine tubes, also known as the fallopian tubes, and the ovaries. And here's a sagittal section or mid-sagittal section of the internal organs of the female reproductive system. So here is the inner labia minora, we can see this is the bone of the pubic symphysis. Here's that fatty pad making up the mons pubis, and then attached to the inferior border is the clitoris, with the glans clitoris being the anterior most part of the labia minora. We know that the bladder is located anterior to the uterus here, and the uterus kind of sits on top of the urinary bladder. So there is the external urethral orifice, and then we have the vaginal orifice. So this orifice right here is the opening to the vaginal canal or vagina. So the superior portion of the vagina, we see the cervix. The cervix makes up the lower third of the uterus, and we can see the uterus here located posterior and superior to the urinary bladder. And then from the uterus on the lateral sides, we can see one of the fallopian tubes or uterine tubes held by the suspensory ligaments of the ovary. So the fallopian tube ends in these finger-like projections called fimbriae, which kind of envelope the ovary. And then we have our different glands that we can see within the vestibule. Again, the vestibule is that area contained within the labia minora. So here are the internal female reproductive organs. Again, here is the vagina. Superior to the vagina is the uterus. And the uterus, the lower third of the uterus is the cervix. So the cervix is actually part of the uterus. Now the cervix is important because it allows for entrance into the uterus. So when sperm goes up the vagina, it will enter the cervical os, go up the cervical canal, enter the body of the uterus, and then hopefully meet up with an ova or egg. And usually fertilization, the majority of fertilization occurs within the ampulla, this section of the fallopian tube. So we can see different suspensory ligaments that hold the uterus in place. We can see the mesometrium, which is what's holding the body of the uterus in place. There's the mesovarium and the mesosalpinx, again, part of the ligaments that hold these structures in place. The ovaries are small almond-shaped organs that produce the ova once a month. Again, they are held in place by ligaments and mesenteries. We have the broad ligaments and the different parts to the broad ligament. There's the suspensory ligament and the ovarian ligament. So the ovarian arteries are what give the ovaries their blood supply, and the ovaries are innervated by both divisions of the autonomic nervous system, both sympathetic and parasympathetic. Like the testes, the ovaries do have a fibrous capsule called the tunica albuginea. This is the fibrous capsule of the ovary, and it's covered in a simple columnar epithelium. The cortex of the ovaries, so again, cortex being having different layers, with the outer layer being the cortex, the inner part being the medulla. It's the ovarian cortex, that outer layer, that houses the developing oocytes. Follicles, these are multicellular sacs that house the oocytes. And then within that middle layer, that inner layer, is the ovarian medulla that contains loose connective tissue. So within the ovarian medulla, we have blood vessels, lymph vessels, and nerves. And here is a picture of a section of the ovary. So we have the outer cortex that contain the follicles, and it's surrounded by the tunica albuginea. And then within the medulla are important blood vessels and nerves. So as the follicles mature, only one egg will be released once a month in a female within the reproductive age. The next structure are the uterine tubes, or the fallopian tubes. So the fallopian tubes receive the ovulated oocytes, and we have different parts to the fallopian tubes. So first, where the fun begins, is the infundibulum. This is the distalmost end of the uterine tube. and surrounded by the fimbriae. Again, the fimbriae are these finger-like projections that kind of enclose the ovary and catch the ovulated oocyte. The next part of the fallopian tube is called the ampulla. So it's sort of a dilated section of the fallopian tube. This makes up the middle third of the fallopian tube, and this is where the majority of fertilization takes place. So this is the usual site of fertilization where the sperm meets the egg. Then we have the isthmus, which is the medial third of the uterine tube. So here we see a cross-section of the fallopian tube through the ampulla. We can see that muscular layer, and then we see an enlargement of the mucosa. We have ciliated columnar epithelium and some non-ciliated epithelium. Again, that cilia important for the movement of the oocyte towards the uterus, and if it is fertilized by a sperm, it will move towards the uterus due to the ciliary actions of the epithelium and hopefully implant into the uterus. And again, just showing you the internal female reproductive organs. We can see out in the cortex the different follicles, and only one follicle will ovulate an oocyte, which will then travel down the fallopian tube. So first we have the infundibulum, where the fun begins, and attached to the infundibulum are those finger-like projections called the fimbriae that will catch the oocyte, and the egg will travel down the fallopian tube. Here we have that dilated portion of the fallopian tube called the ampulla, where the majority of fertilization takes place, and then it will further travel down the fallopian tube where it hits the uterus, and if the egg has been fertilized, it can transplant within the lining of the uterus. And we'll talk about the uterus as well as the parts of the uterus and the layers, the different layers that make up the wall of the uterus. So the uterus lies anterior to the rectum, but posterior to the urinary bladder, as we saw in that mid-sagittal section of the female reproductive organs. The normal position of the uterus is anteverted, anteflexed, and we'll talk about that in just a little bit. So parts of the uterus includes that rounded dome-like structure, which is the superior portion of the uterus called the fundus. We then have the lower third of the uterus called the cervix. This is considered the neck of the uterus. The inferior opening of the cervix is called the external os. This is the opening that we see when we as clinicians do a pap smear, and we take our samples from the external os. The external os goes towards the inside of the uterus via the cervical canal. This is the passageway or the canal that communicates with the vagina inferiorly. And then you have the internal os, which is the inside opening, so the opening connecting with the uterine cavity. And we can see this on the next slide. So again, we have the external os here, we have the cervical canal, and then the internal os. So the normal position of the adult uterus is anteverted, anteflexed. You may see a question on that, so make sure you take note of the normal position of the uterus. So anteverted, this means that the uterus is tipped anterosuperiorly relative to the axis of the vagina. Notice there's a V in anteverted, so there's a V in vagina. So it's tipped relative to the axis of the vagina. The adult uterus is also anteflexed, so flexed or bent anteriorly relative to the cervix. Okay, so notice there's an X in anteflexed and there's an X in cervix. So anteflexed, bent anteriorly relative to the cervix. So anteverted, anteflexed. This slide shows the peritoneal reflections around the female pelvic organs from a supero-anterior view. So we can see this rectouterine pouch. This is also known as the pouch of Douglas. So this is a pouch between the rectum and the uterus. And then we can see the round ligament of the uterus here, which has its connections towards the anterior portion of the pelvis. And then we have different parts of the broad ligament that kind of anchor down the uterus. So we have the mesosalpinx. So whenever you see the word salpinx, salpinx is actually in reference to the fallopian tubes. So for example, we used to do hysterectomies, meaning in patients that needed to remove their uteruses, sometimes they would also remove the fallopian tubes. So the actual procedure was called a TABSO, T-A-H-B-S-O. So TABSO stood for Total Abdominal Hysterectomy Bilateral Salpingo-oophorectomy. So salpinx referring to the fallopian tube. So a TABSO was a removal not just of the uterus, but also, so bilateral salpingo-oophorectomy was a removal of both right and left fallopian tubes as well as the ovaries. So usually this would involve patients that had some sort of cancer or that just wanted to remove the reproductive organs. Now, funny to note that hysterectomy. So back in the 1800s, 1900s, male doctors used to think that the origin of most women's mental problems or hysteria was due to the presence of a uterus. So, you know, when they would say that women were hysterical, they're referring to the fact that she, you know, had a uterus. So removal of the uterus is called a hysterectomy because the uterus, according to early misogynistic doctors, they thought that the uterus was the origin of their hysterics, or female patients being hysterical, which we know isn't true. It's usually the men that cause hysterics among women, but that's another debate. So here we see a mid-sagittal section again of the organs of the female reproductive system. So we have our vestibule. So our vestibule within the confines of the labia minora. So if you follow up anteriorly the borders of the labia minora, this is where you will find the clitoris. So within the vestibule, we have our openings. We have the urethral opening, and we have the vaginal opening. Here is the vaginal canal or vagina, and then we see the cervix here, the lower third of the uterus. The external os is that first inferior opening of the cervix. Then we have the cervical canal and the internal os. Then we see the actual body of the uterus, and we'll get into parts of the uterus as well as layers. So basically the layers of the uterus, we have the inner layer, we have the endometrium. This is the layer that is shed once a month during menstruation. Then we have that middle muscular layer, and that is the myometrium. And then we have the outer layer, which is the perimetrium. In this picture, we can also see some of the ligaments that are kind of anchoring the uterus down. We have the suspensory ligament of the ovary. Here we have the round ligament, which is attaching anteriorly. And then important to note that the suspensory ligament actually contains some of the important blood vessels giving blood supply to the reproductive organs. So the uterus is supported by the mesometrium. So mesometrium is part of the broad ligament. The broad ligament is a large fold of peritoneum that hangs from the uterus and the uterine tubes like a tent. So the mesometrium kind of helping support the uterus. The cardinal ligaments, these are ligaments that are horizontal from the cervix and the vagina, and then the round ligaments bind the uterus to the anterior pelvic wall. And here are the layers of the uterus. We have that outer layer, which is the perimetrium. The serous layer is the peritoneum, and then we have that middle muscular layer, the myometrium, which are interlacing bundles of smooth muscle. Smooth muscle, very important in contractions that allow for childbirth. And then we have that inner layer, the endometrium. Again, this is the mucosal lining of the uterine cavity. This is the lining that is shed once a month during menstruation. Within the uterine wall, we know that the fertilized embryo will burrow into the endometrium. The endometrium actually has two layers. It has a functional layer and a basal layer. With regards to blood supply, the uterine arteries send branches to the uterine wall and divide into arcuate arteries. We then have radial arteries, which reach the endometrium and branch into straight arteries found in that go to the basal layer, and the spiral arteries, which go to the functional layer. It's these spiral arteries that will undergo degeneration and then regenerate with the menstrual cycle. So if we look at this next slide, we can see the spiral arteries here in this functional layer. And it's these spinal arteries that will undergo degeneration and regeneration during the menstrual cycle. So the endometrium, again, having two layers, the functional layer where the spiral arteries are located, and then we have the basal layer of the endometrium. And below the endometrium, of course, we have that middle muscular layer, which is the myometrium. So the monthly menstrual cycle is due to hormonal fluctuations in ovaries and the uterus. We have different parts of the menstrual cycle. We have the ovarian cycle and the uterine cycle. So the ovarian cycle stimulates production of ovarian follicles and oocytes. And we know once a month, only one oocyte will be released. When I was in medical school, I was class president my second year of medical school, and the teacher, Dr. Kaur, she was very strict and very scary and terrifying, and you know, very old school, but she knew that I was president of the class, so she had me do a production to kind of do a representation or a kind of skit of the menstrual cycle. And one of those skits involved the Miss Graphian Follicle, or the Miss Primary Follicle pageant, because once a month only one follicle or one oocyte is picked to ovulate, and the skit involved having, you know, a bunch of contestants, and only one could be picked in order to ovulate. And it was pretty funny, and I made her laugh, and I wasn't sure if she was laughing at me or the skit, but I was happy to say that I passed. So the ovarian cycle is basically a picking of which oocyte or which ova will be released every month. Now the uterine cycle, this is the cycle in which preparations are made, and it prepares the uterine wall for implantation of the fertilized egg. So first we talk about the ovarian cycle. The ovarian cycle has 3 successive phases. There is the follicular phase, ovulation, and then the luteal phase. The follicular phase makes up the first half of the ovarian cycle. So we have about 6 to 12 primordial follicles stimulated to develop, and the growth is stimulated by the follicle stimulating hormone, same hormone that has its effects on the male reproductive system. So the follicle stimulating hormone is secreted from the anterior pituitary gland. Primordial follicle will then become a primary follicle, and the primary follicle will have different layers. For example, there's a zona pellucida. This is a glycoprotein coat that surrounds the oocyte, and then there's a theca folliculi. This is the internal layer that will secrete hormones. So an antrum will form, and this is a fluid-filled cavity between the granulosa cells of the follicle. The primary follicles will then become a secondary follicle. Within the secondary follicle, you'll see the structure called the corona radiata. This is a coat of granulosa cells that surround the oocyte. The secondary follicle will enlarge and become a vesicular or Graafian follicle. It's this follicle that is ready to be ovulated. So the secondary follicle becomes the Graafian follicle or the vesicular follicle. So in the skit, we had a Miss Graafian follicle pageant. So this follicle that has been picked to be ovulated. So ovulation occurs about halfway through each ovarian cycle, usually about day 14. One mature oocyte will exit from one ovary, will enter the peritoneal cavity, and the fimbria, or those finger-like structures from the infundibulum end of the fallopian tube, will sweep that one mature oocyte into the fallopian tube. Before this occurs, there will be a sudden increase in luteinizing hormone, which is a signal for ovulation. The next phase of the ovarian cycle is the luteal phase. This occurs after ovulation in the last half of the ovarian cycle. The remaining follicle becomes a corpus luteum, will secrete progesterone. This acts to prepare for implementation of an embryo. So progesterone is this hormone that is secreted in case the egg has become fertilized, and will basically tell the body, the body is pregnant. However, if there is no implantation, if there's no fertilization, no implantation, the corpus luteum will die and become a atretic corpus albicans. So basically it will become absorbed. So when we talk about birth control pills, notice that we talk about certain hormones that are involved in the making of birth control, either birth control pills or injectables. Progesterone. Progesterone is that hormone that is often used to make birth control, either pills or birth control injectables. Progesterone basically tells the body not to ovulate anymore because either, it's pregnant or implantation has occurred. That's why we use progesterone as one of the hormones for birth control. So here we just see the different parts of the ovarian cycle. So here we have our primordial follicles that are located in the cortex of the ovary. Primordial follicles will then become primary follicles, which will then become secondary follicles. And we see this layer of granulosa cells within the secondary follicle. And then we have within the secondary follicle or the antral follicle, the forming of an antrum being that space within the follicle, and then we have an outer layer called the theca folliculi. So then we have a mature ovarian follicle, also known as a Graafian follicle, that carries out mitosis 1, and it is ready to be ovulated. Mitosis 2 doesn't occur until fertilization. So this Graafian follicle or mature ovarian follicle is what will eventually become ovulated. So here is that space, and then surrounding, called the antrum, and surrounding the mature egg is the zona pellucida. So the follicle will rupture, and the secondary oocyte is then ovulated. The corpus luteum is basically the structure that forms from the ruptured follicle, so it's what remains after the egg has been ovulated. And if the egg becomes ovulated, the corpus luteum, it's this structure that secretes progesterone. Progesterone occurs in the face of implantation because of fertilization, basically telling the body, telling the ovary to no longer ovulate once the female becomes pregnant. So if there is no implantation, then this corpus luteum will then become atretic and become absorbed. So here we can see fluctuation of hormones during the menstrual cycle. So we see fluctuation of pituitary gonadotropins such as follicle-stimulating hormone and luteinizing hormone that helps regulate the events of the ovarian cycle. So for example, we have this huge spike of luteinizing hormone just before ovulation. Now, for those that actually follow their cycle, the luteal phase is the most constant phase. So if you are able to calculate the luteal phase, for me, usually it's about anywhere 10 to 12 days. This is a set number. You can be able to, you'll be able to kind of have a good idea as to when ovulation occurs within your cycle. So basically you count, if you know your luteal phase is 10 days exactly. So the first day of your period, 10 days before that will be the start of the luteal phase, which can tell you when you have ovulated, if that's something that you're interested in when it comes to your own family planning. So here is the ovarian cycle, the structural changes that occur in the ovarian follicles that are correlated with the changes in the endometrium during the uterine cycle. So we have that follicular phase where we have maturation from a primary follicle to a secondary follicle to a mature ovarian follicle. Then usually about day 14 is when you have actual ovulation, and before that, preceding that, is that surge of luteinizing hormone that kind of heralds in ovulation. And then the luteal phase, this is when after the egg has been ovulated, you have that structure called the corpus luteum that secretes progesterone and will continue secreting progesterone if there has been fertilization and implantation of the fertilized egg within the uterus. If there has been no fertilization, then it degenerates and becomes absorbed. Now, oogenesis takes many years to complete. Usually, primordial follicles are arrested or stalled in meiosis 1. So meiosis 2 doesn't occur until you have actual fertilization of the egg. We know that the surge of luteinizing hormone also causes the primary oocyte to complete meiosis 1. So oogenesis produces only one ovum and 3 polar bodies. Now, the polar bodies do not contribute to the developing embryo. Meiosis 2, again, is completed only if sperm penetration has occurred, meaning fertilization has occurred. And that's when the fertilized egg undergoes meiosis 2. So here is just a schematic of the meiotic events that occur before birth. We know that once with the development of the oocyte, it is stalled in meiosis 1 and usually is arrested in meiosis 1 until puberty. And then we can see the development of the mature ova, and we know that there's only one mature egg that is ovulated, whereas the others become polar bodies. And then we see development of the follicles in the ovary, occurring in the cortex of the ovary, down to the degenerating corpus luteum. The uterine cycle, so this is basically the cycle that occurs within that inner layer of the uterus, the endometrium. So the phases coordinate with the ovarian cycle and are directed also by those 2 hormones secreted by the anterior pituitary gland, the follicle stimulating hormone and luteinizing hormone. The uterine cycle also has phases. So the first 5 days, so days 1 through 5, are considered the menstrual phase. Some menstrual phases are longer than others, but days 1 through 5 considered the menstrual phase or menstruation. This is when the stratum functionalis, or that functional layer of the endometrium, is shed. After the menstrual phase, you then have a proliferative phase. This is when we have regeneration of the endometrium, and this occurs during days 6 through 14. And then we have the secretory phase, these occurring during days 15 to 28. And this is if we, a normal menstrual cycle is usually about 28 days. And of course, they vary from woman to woman. So here we see the fluctuation of hormones during the different phases of the menstrual cycle, specifically the uterine cycle. So we can see that usually the first few days, the hormones estrogen and progesterone are relatively low, and then right before ovulation you have that surge of estrogen that occurs during ovulation, and then, you know, after ovulation the corpus luteum will then start secreting progesterone until, you know, it figures out, okay, the egg has not been fertilized, so then the corpus luteum basically dies, becomes a trid egg, and then becomes absorbed. Okay, so we know that fluctuating levels of estrogen and progesterone will cause the endometrial changes of the uterine cycle. High estrogen levels are also responsible for that luteinizing hormone and follicle stimulating hormone surge. Here we see the three phases of the uterine cycle, days 1 through 5 being the menstrual phase. This is when we have the shedding of the endometrial lining. Then we have the proliferative phase, where we have regeneration of the endometrium, and then we have the secretory phase. So it begins immediately after ovulation. We have an enrichment of the blood supply and glandular secretion of nutrients, which helps prepare the endometrium to receive a fertilized embryo. So both the menstrual and proliferative phases occur before ovulation, and they correspond to the follicular phase of the ovarian cycle. The secretory phase corresponds in time to the luteal phase of the ovarian cycle. And that is ovulation and the menstrual cycle. Moving on to the vagina. The vagina consists of 3 coats. We have the outer fibrous connective tissue layer, which is the adventitia. We have that middle muscular layer, muscularis layer of smooth muscle. And then we have that inner mucosa marked by transverse folds and consists of a lamina propria and a stratified squamous epithelium. Now, in female patients who have not had any sexual relations or sexual contact, they could have the presence of a hymen. The hymen is just an incomplete diaphragm. Back in the medieval times, a woman's worth was based on whether or not this hymen was still intact, which indicate that the woman was still a virgin, meaning she still had value back then. But those were, you know, in the dark ages, because a woman's worth does not depend on whether or not she has a hymen. Other structures within the vagina, we have fornices or a fornix. The fornix is basically a recess formed at the superior part of the vagina. So basically it's that space that surrounds the cervix at the superior part of the vagina. And we can actually see the fornices or the fornix in this picture. So see this space that kind of surrounds the cervix? That is the fornix. And then there's, you know, an anterior fornix and a posterior fornix depending on where it's located. But this fornix or fornices is part of the vagina and surrounds that lower third of the uterus, the cervix. Here we see all the internal structures of the female reproductive organs. Again, the different layers of the uterus, the endometrium, the myometrium, and then the outer perimetrium. We see the ovaries with their outer cortex, inner medulla, and the follicles that are located within the cortex. And then the different parts of the uterus, the fimbriae attached to the first part of the fallopian tubes, which is the infundibulum. Then we have this dilated section of the uterus being the ampulla, where the majority of fertilization does occur. We have this ovarian ligament that kind of anchors the ovary to the uterus. You can see the ovarian ligament here. We have the suspensory ligament of the ovary, where we see ovarian blood vessels within the suspensory ligament. If we are able to see, if you guys ever get a chance to see the cadaver section, we can see the actual blood vessels within the suspensory ligament of the ovary. And then we have the different sections of the broad ligament. Again, we have the mesosalpinx, that is the part of the broad ligament attached to the fallopian tubes. We have the mesovarium attached to the ovary, and then the mesometrium, that broad ligament that is attached to the body of the uterus. So we can't talk about the reproductive system without mentioning the mammary glands, the breasts. Breasts are basically modified sweat glands. They have a glandular structure, and they are undeveloped in non-pregnant women. Now, milk production occurs in the breast and usually starts at or after childbirth. So in this next picture, we can see the many ducts that make up the mammary gland. So this is a structure of a lactating, milk-secreting mammary gland. So all these ducts leading to the opening at the nipple. So the nipple is this dome-like structure where we have opening of the lactiferous ducts, and the surrounding darker tissue around the nipple is the areola. Pregnancy. Now, there are many events leading to fertilization. So, of course, fertilization has to occur with the presence of sperm. The sperm will bind to the zona pellucida and then undergoes this acrosomal reaction. The acrosomal reaction basically prevents other sperm from entering the egg. So the sperm will release enzymes to form a slit in the zona pellucida, and then fusion of the oocyte and sperm will occur. So fertilization of the oocyte and sperm creates the fusion of their plasma membranes. The cortical reaction occurs, and enzymes prevent any other sperm from binding to the egg. Fertilization is when you have chromosomes of both the male and female gametes join. So here is a lovely picture of the events leading to fertilization, the acrosomal and cortical reactions. So here we see the acrosomal reaction. The acrosomal reaction releases digestive enzymes, allows it to create this slit within the zona pellucida of the oocytes. Once this slit occurs, the sperm is able to enter the oocyte, and then we have a cortical reaction. Basically, the plasma membrane of a single sperm will fuse with the plasma membrane of the oocytes, and the sperm nucleus is engulfed by the oocyte cytoplasm. This fusion will then induce the cortical reaction, in which the granules in the oocyte will secrete enzymes into the extracellular pellucida and destroy the sperm receptors so that no other sperm can bind to the oocyte, so preventing any other sperm from binding to and entering the egg. So that is the cortical reaction. So acrosomal reaction, basically digestive enzymes are secreted so that they can enter the egg. The cortical reaction occurs so that no other sperm can bind. So now the sperm has joined with the oocyte and we have fertilization. So this picture is showing you the resultant zygote with chromosomes from both male and female gametes. We have polar bodies within the zygote, and then we have fertilization of the egg. I'm going to stop right there for female reproductive system, female reproductive anatomy. The next part of this chapter will focus on implantation, pregnancy, childbirth, and then disorders of the reproductive system.